for joining with us. So we'll start the recording now. Okay. First of all, I want to thank you all for joining us today. I am Dr. Ruth Oots Moore and have the privilege of presenting with my student, or it's not my current student in this class that I'm teaching this term, but he has been my student, Corey Burks, and we'll get into introductions. But at first, just like I said, want to thank you all for joining us today and spending your afternoon, morning, whatever time zone you're in with us. So as I said, I'm Dr. Ruth Oots Moore. I am an associate professor here at the Chicago School of Professional Psychology Online. I have been a counselor educator for 22 years, and I've been a clinical mental health counselor for, 27, 28 years. I stopped counting because then that means I'm not an adolescent anymore. So I'll tell you a little bit about me. So I actually have been a fitness instructor longer than I've been a clinical mental health counselor, if you can believe that. So fitness has always been my passion. Had a little hiatus. There were some injuries, but I do have several fitness certifications, an AFA certification, and also a lifetime spinning certification, and some others along the way. And so yeah, and I'm just very passionate about implementing any type of activity in counseling with clients. And so Corey does a lot of work in this area, and let him introduce himself, but we just kind of felt like this was a good fit for us to maybe see how we could do more of this in counseling. So Corey, I'll let you introduce yourself.
Yeah, sure. First, thank you for the kind words. And I must say the privilege is mine of having the opportunity of working with you. A little bit about myself. As Dr. Moore said, I have been a personal trainer, fitness coach, fitness professional for about 15 years. I guess I'll back up. I have a bachelor's degree from University of Massachusetts, Amherst. My concentration was in behavioral economics and health science. So I think, over my decade and a half, let's say, and many thousands of hours coaching many different types of people, from athletes to older adults who have chronic conditions or diseases, and pretty much everybody in between, some people with obesity. So pretty much I've worked with individuals across populations, gender, age as well. And when I first started, I struggled a lot because I didn't understand so much of behavior change, and improving your overall health and fitness had so much to do with the mind and your mental health. So over the years, I've kind of really tried to develop my skills and coaching skills with helping people improve just their mental approach to health. So I guess what I'm trying to say is across populations and across all the people I've worked with, no matter the condition, I would say the major or single denominator across all those people improving their conditions is their mental health and their ability to have a positive outlook towards change. And it's a reciprocal process. The more I saw, the more that people were able to engage in healthy behaviors, not just exercise, but a range of healthy behaviors, it had an effect on their mood and on their mental functioning. So this is kind of why we're here today, presenting on this topic. So long introduction, long-winded. Let's get started, Dr. Moore. And a lot more to come.
Thank you. Thank you, Corey. So we're going to be talking today about moving toward wellness and how to integrate physical activity in counseling. Just briefly, so our goals for today in terms of learning objectives are we're going to talk about some of the benefits of implementing physical activity in counseling. We're going to explain how physical activity can help clients develop purpose and meaning from a humanistic perspective. And also, we're going to talk about how a lack of physical activity can affect a client's social well-being. So I'm going to just talk for a moment about some of the health benefits of physical activity. And we know that this is nothing new, right? I mean, we all know that there are physical benefits of or their health benefits of physical activity. It can prevent obesity. And we know that individuals who are obese or larger bodied individuals are more at risk for heart disease, diabetes, high blood pressure, stroke, and cancer. And certainly, while individuals who are not larger bodied can experience those health complications as well, that individuals that are obese, larger bodied are certainly more at risk, and their physical activity can help prevent that and prevent some of those other conditions. It decreases cardiovascular disease. It can decrease non-insulin dependent diabetes, or, I've had clients before who were able to stop taking their, that weren't insulin dependent, they were insulin resistant, but they were able to stop taking medication. It can prevent colon cancer. There's a lot, and I cited an article here because the list goes on of all of the physical benefits. We could spend a whole day on that, right? But also the mental health benefits associated with physical activity. And you heard Corey kind of talk about some of his experiences with that. And for me personally, whether we're talking about in the fitness arena, that certainly when people came to my fitness classes, or have some personal training experience many months ago, but when they would come in, that you could start to see, whether you're working with someone in a gym or clients that you're working with in a counseling session, that physical activity really is beneficial, that it can help alleviate depression and anxiety, or decrease it, that it might not overnight disappear, but you will find that your clients will start to say, hey, it's a better week than it was last week, and go from there. It can decrease symptoms associated with PTSD, increases their self-esteem, also provides opportunities for socialization. So when you think about different mental health disorders, like think about depression, think about anxiety, that a lot of times clients withdraw. They're depressed, they can't get out of bed, they withdraw from everyone. And so this gives them an opportunity for socialization, but maybe in a way that is a little more comfortable or less anxiety provoking. Physical activity enhances overall emotional and social well-being. Think about it. If you go for a walk with your friend, that increases your social well-being, that you feel better, you connect with someone else. And we'll talk about a theoretical orientation and a little bit later in the presentation. And it reduced risk of developing comorbid mental health issues, often associated with chronic physical disease and conditions. So yes, we certainly know that we can have both. You can have health issues, and that can lead to mental health issues, and you can have mental health issues that cause you to have health issues. There are a lot of individuals you see with chronic pain that have a depressive disorder diagnosis. So sometimes those two things go hand in hand. And it is empowering that when I've had clients who have not been able, for whatever reason, to engage in physical activity, that when they begin engaging in physical activity, that they really do feel empowered.
Yeah, so just kind of echoing Dr. Moore in the previous slide, all that stuff is, we see it on a presentation, we see it in an article, we see it in a book, but it's really true. Like it's very, very powerful, and it's really, all those things are very, very true. And to see those things happen in real time, or over a course of time is, it's pretty incredible. And I've seen physical activity to those points really change people's lives. So I just want to kind of really hammer home that it is real, it does work, and a lot of people really swear by it. So Yeah, health challenges. When people do have an inactive lifestyle, so we have environmental factors that often prevent people from engaging in physical activity. It compromises, as we just kind of alluded to, their physical and emotional health. So basically, what this is saying is that modernity has kind of taken away our, I don't want to say ability, but our opportunity to move, right? Everything is within the grasp of a hand. We have a lot of time spent on the screen. Uh, Even it's easy getting our food. I mean, everything is just built around making our lives very, very easy. And our bodies have adapted over time to be able to conserve energy when we feel that uh, times might be rough. So, like, yeah, we have this capacity to store energy that kind of is a mismatch between the environment that we find ourselves in today. So it's very easy for us to slow our metabolism when we're not moving. And that causes a range of issues. Um,
Oh, and I was
yeah,
just going to
so
say, I think about some of the clients that I have seen, or think about yourself, like, and look at kids nowadays. They're on screens. When I was a kid, we were riding bikes until our parents yelled out the door for us to come inside, and because it was getting dark, and that we kind of see a shift in some of that as well.
yeah, I think definitely parenting styles have changed. Yeah, I think just about every point, every domain of our lives, especially in Western societies, it is to make things easier, and in turn, it has made us much less active. Yeah, throughout the lifespan. Um, yeah, so again, alluding to kind of what we were previously talking about. So sedentary behavior is a risk factor for a range of poor health conditions, physical conditions, and also mental health conditions. Um, Kind of again touching on living in a, I guess, an industrialized and even a post-industrialized society. Um, Many of us we've traded off health behaviors for the ability to work, to have a family, uh, and just to do a range of other things. So to that point, what I've seen in my practice is that trade-off, kind of early on in the lifespan, up until about, I don't say, let's say middle age is kind of when becoming more physically active and being aware that you need to take care of yourself becomes really more salient as you get older. Um, so I think the point here is if we can really kind of instill uh, uh, the importance of physical activity starting at a young age, and kind of keep that sort of mindset throughout the lifespan. When you do get older, life will be much easier for you. And I think the biggest one for me here is, yeah, perceived lack of meaning has been shown to be a predictor for lack of physical activity across populations. And this kind of goes back to the trade-off thing. It's really instilling the importance of physical activity and health behaviors starting at a young age, and on through the lifespan. Um, but there needs to be meaning there. So I think what I've seen is the more meaning people have in their lives, and I've seen this with hundreds and hundreds of clients, the more they're able to be physically active and produce health behaviors. And finally, yeah, a lot of people, I would say, especially lower SES individuals, really lack the resources to be able to learn how to be physically active and actually learn healthy behaviors. So that's another big gap that we have to bridge.
Well, and I was just going to say, it really does become a vicious cycle sometimes when you think about, like, let's use a client, for example, that has a depressive disorder, and they say, I'm so tired, I can't get out of bed. I don't have the energy to get out of bed. And, even though we might know that, okay, physical activity of some sort is going to help you feel better, but it's then they don't have the energy to do it. So they don't do it, and then they're more depressed. So it's really figuring out how to help clients break that vicious cycle. And like Corey said, it is a trade-off sometimes when you think about it. And I gave this example when Corey and I met earlier today, but I was like, I said I was going to go to the gym yesterday, but I had too many meetings. And I said I was going to go today, but I have too many meetings. And we begin sometimes to have that trade-off of like, well, I've got to get this done. I don't have to go to the gym today. And I think it's even more challenging with clients who do have mental health disorders or emotional issues. And so there is that, like we said, trade-off of, and that when you get to adulthood, or when you get to your 65 and all of a sudden you've got, cancer, or you've got, other health problems, that's where this panic of like, oh gosh, I've got to exercise. I've got to, engage in physical activity. So we're going to help discover some ways we can help clients not wait till they're 65 to get moving. So Corey, were you going to talk about this one? I can't remember.
Yeah. So the benefits of physical activity and counseling, and I think defining physical activity and counseling has been a major hurdle within the profession. And much like any other way of trying to come up with a construct, it's pretty difficult, right? So we just have this preliminary sort of way of conceptualizing physical activity in counseling. It's very basic, implementing any type of movement with the client in the counseling session. And it's broad, right? Which is good, is kind of leaves room for a lot of different types of activities. And, I think the connotation we have with physical activity, often it's very much associated with exercise, like going to the gym, lifting weights, running a half marathon, increasing your heart rate, sweating, and all of those images that we get from popular culture about exercise is often associated with physical activity. Now, I think that can kind of create some anxiety, right? Especially with people who do have anxiety, right? It's going to create even more anxiety about exercise, about physical activity. And it can kind of maybe create a perceived barrier, especially with people with anxiety and depression, that, oh, it's going to be too hard. I don't have the energy. Maybe it's going to make me feel even worse, and so on and so forth. So what we don't want to do is necessarily associate physical activity with popular notions of exercise. And Dr. Moore, can you talk about informed consent here, please?
Yeah. So I think Corey makes a good point. And we're going to talk about in a moment about some of the barriers that prevent people from engaging in physical activity. But the word exercise sometimes for certain people can bring about a sense of dread. I mean, there's some people who love to exercise and it's like, oh, I'm going to exercise. But for other people, the word exercise seems strenuous, may seem strenuous or an unrealistic expectation. And that's what we don't want to have happen. So physical activity and counseling doesn't have to mean that you are doing yoga with them on the floor or any of those things. There are ways, and we'll talk about that momentarily, of how to implement that. So one of the first things, though, is that it gets kind of tricky of like, well, how do you do this exactly? Are you going to do yoga on the floor with them? What are you going to do in terms of physical activity with them? And so first of all, I think it's important that you know in your informed consent that you are a counselor with a background in wellness, you can call yourself a wellness counselor, however you want to phrase that, but that you implement your theoretical, part of your theoretical orientation is, and we're going to talk about humanistic counseling, but humanistic counselor with background and training in wellness. And so I operate from a very holistic or wellness approach. And with that, I incorporate movement or physical activity in counseling. I mean, certainly we do that with consent, but I do want that noted in my informed consent so that clients are aware that this is going to be part of what counseling could be. So that just like if you go to a counselor and they're a behaviorist and a behaviorist isn't a good fit for you, you don't have to see that counselor. So you want them to know. And with that, I think it's important during your intake process to assess for wellness. What are they active? What are they doing? When's the last time they were active? How they felt when they were active before, but really getting an understanding of where they are in terms of health and wellness, but also recognizing the importance of meeting clients where they are, that just because someone hasn't engaged in any physical activity in 10 years, we don't want to make them feel any kind of sense of shame or anything like that. So it's meeting them where they are and helping them figure out what goals they have for themselves.
Yeah, and I kind of want to add to that a little bit, just one little snippet here, Dr. Moore, if I may. Yeah, the wellness I think that we need to make sort of a wellness assessment part of every counseling intake. I firmly believe that it's almost a non-negotiable thing. You can't escape your body, right? And however you choose to approach wellness interventions is up to you based on your orientation. But I do think it needs to be a universal part of the counseling process. Again, we cannot escape our bodies. We cannot escape trying to be as healthy as we can because it has major implications both physically and mentally. So just had to throw that in there.
Yeah. Well, and also there's some special considerations when implementing physical activity. Shame is one. And so when I think about many of my clients who have struggled with weight or report having, low self-esteem and lifelong struggles with weight, or, whatever the case, whether it's long-time history of depression, trauma, any of those things, there can be a sense of shame around that if feeling as though, oh, what are you doing? Like Corey mentioned, the wellness assessment, that we don't want clients to feel like because we're asking questions about what do you do for physical activity, what do you do for self-care, we don't want them to feel a sense of shame around the fact that they haven't been engaging in physical activity. We also have to recognize that a lot of clients have negative body image. So physical activity is often associated with weight. And that's not to say that's how we want it to be, but I think some clients who've had negative experiences may associate that physical activity with body image, weight, and they may have a negative body image. And then I think it's important too, before implementing any type of physical activity with clients, is that you understand what their likes and dislikes are. We're not going to ask clients to do something that they hate. It's kind of like working with adolescents. If they don't like writing, you don't want to ask them to journal because they're not going to want to do it. So you want to find out what their likes and dislikes are. A lot of times I'll hear clients say things like, oh, I used to be a part of a walking group in my neighborhood, but I just, I hurt my knee and I haven't been able to do it. And, but understanding what they like and dislike. And if someone says, no, I hate yoga because it makes my joints hurt, then that's not going to be something that we look at doing. And I think the other part is that there are ways to implement physical activity in counseling and then to help them transfer that desire to engage in physical activity in the outside world. So I may not say, I'm not going to do yoga with my client in a session, but I may use physical activity with them. And then they may decide, you know what, 10 years ago, I did yoga and felt so good. I think I really want to get back into that. But we want them to take what they're getting and recognize the benefits, even if it's just a baby step, so that they might be more apt to engage in that activity in the outside world. So how do you do that? We're going to talk about some things related to training and all of that. So for me personally, I like my clients to get moving. If they haven't, they're not being active. I've had clients where we dance, we turn on music, even if we just kind of move our shoulders, we move, or we may walk around the building. We've had clients that just said, I might say, when's the last time you got out of the house? When's the last time you got some sunshine? What are your thoughts around, let's just take a little walk around the building. I put on music. What kind of music do you like? We play a song, we walk around the building. And once had a client that she actually had a lot of anger, and she felt like she just couldn't get it out, and she'd experienced a lifelong history of trauma, and she's like, I just feel like I've got this anger, I want to get it out. And so she decided, I said, well, what do you think would help? And she's like, I need to scream, but I can't scream. And she said, I think I want to throw something. And so I said, what would you like to throw? So she decided she wanted to throw eggs. So in the not at anybody and not at anybody's house, but we went in the back, and I had this, there was a lot of wooded area, and she went and she threw eggs at trees and was able to release some of that. But that was the first time that she had really had any kind of physical activity, because she was having so many flashbacks and issues with PTSD related to the abuse and trauma she had experienced. So walking, getting just any type of movement, stretching, and stretching can be just something as simple as, let's stretch while we're at our, sitting in the office, and then breathing. There's certainly all kinds of breathing activities. And if you come to my Friday morning session on autism, we're going to be talking about some breathing and mindfulness stuff that you can do. But breathing, sometimes we don't think of breathing as being physical, but if you really get clients to engage in that breath and really dump that out, you can feel that physical release, and helping them just see how good it can be to just allow yourself time to breathe. So one of the barriers to implementing physical activities in counseling is certainly like, oh gosh, how do you do that? And I think one of the things that you have to be mindful of is that you have to understand the client's ability and any injury. I certainly don't want the liability around asking a client to stretch, and then they, pop their Achilles or something like that, and then, I'm liable in some way. So looking at their abilities, any injuries, but also getting approval from a physician and a statement of their ability. So if you specifically in your counseling practice said, hey, I'd really like, think this client could benefit just from some stretches. She's got chronic pain, that, and she might benefit from just having some stretching, getting that approval from a physician and having the client sign a release to that healthcare provider. Most importantly, training and credentials. I'm not going to ask a client to do stretches if I'm not trained and have the credentials to be able to do that. So that's the other piece to look at. There are ways to implement physical activity. Like I said, you can walk around the building, but you want to make sure that your client is able to do that activity.
Yeah.
Corey, did
So Dr. Moore, I kind of want to circle back to some of the points that you made in previous slides. Especially you made that connection with physical activity and your client who had that trauma, right? And she felt like she needed to scream. She felt like she needed to get it out. I can tell you that, and this is somewhat gender specific, but with women, a lot of women that I trained, I implemented some boxing with them, just basic pad work, hitting pads. And I can tell you, they light up, and I can tell you a lot of the women I have trained have had trauma, and that sort of release, you can literally see the weight come, like not literally pounds, but they seem lighter. They light up. They feel so much better. And they will tell you, I needed to get that out. I needed to express that anger in some type of way that was cathartic, that's positive. And it's a real thing. It's a very, very real thing, and it does work. And to another point about getting people to engage in physical activity outside of a counseling session, over time, I think it's also important that we, especially with an orientation like this, to have an integrative practice, to have other types of professionals that you work with to help augment what you're doing in counseling. And maybe that is finding a local fitness professional that is reputable, that you trust, to hold classes for some of your clients that might be interested in doing or using physical activity as an intervention. I mean, there's all different types of ways that you can do it that might be able to enhance fidelity to regular physical activity and health behaviors. That was a lot. We'll get to this slide. So yeah, the research is interesting, to say the least. So first point here is there's limited research related to implementing physical activity and counseling from specific theoretical approaches. And I think the general point of interpretation here is, yeah, there's a little emphasis on the art of actually applying the principles that are learned from all of these clinical studies, from all these meta-analytic studies, even a lot of the qualitative studies. Like, there's a lack in actually having some type of structure that will allow you to systematically apply principles of physical activity to help people alleviate mental health challenges, as well as improve wellness and improve their health in other domains. And I think that's kind of why we're here today, is to kind of start the conversation, at least to provide some structure for application. Second point here is there's a huge evidence base for a wide variety of interventions for a wide variety of issues. I mean, so for example, we have trauma-informed yoga. But I can tell you, I mean, sifting through the literature, there have been tons of mindfulness and yoga type interventions for depression, for anxiety, various forms of trauma, PTSD, you name it. But I think that, again, if you're not an expert in exercise science or in fitness or exercise physiology, you're not really going to be able to make the general connections across physical activity interventions to be able to apply them to your people. So I think, again, we need a general framework, not just from a counseling perspective, but also from a physical activity perspective that kind of can be easily integrated with counseling. And again, it's the same point, similar point here. It's hard to measure subjective experience, right? So I guess my biggest point here is, and it's related to the previous points, is that we got to start somewhere, right? And we have to have some type of framework, some type of structure to even start applying physical activity and counseling as an intervention, or at least as an adjunct intervention, so we can start measuring it individually as counselors, so we can start building not so much evidence-based practice, but practice-based evidence, right? Even for yourself. And you can share what you learn through implementing these things in your own practice, obviously with other counselors too. So I guess, Dr. Moore, it's hard to translate measurements of what works for one person to other people, right? Especially when it comes to subjective experience. Even, um, I don't know. There's a sticking point there for me. Like I don't know exactly how to. Uh, um, but I guess there isn't like a catch-all measurement that applies across populations, right? Um, so yeah, I think I kind of got lost there a little bit, but I guess the major point is to have a structure, to start applying it, and to start measuring it with your own clients so that maybe you'll see a pattern develop over time with a certain type of client who's presenting with certain types of issues. That's pretty much what I'm trying to get at.
Right.
And I believe this is you, Dr. Moore.
Yes, so we want to talk about the role of the humanistic counselor. And so I think there's a wealth of information in the literature about the benefits of exercise and physical activity and all of that. But looking at how do we include theory and practice with that. So humanistic counselor, the role of humanistic counselor is, you heard Corey mentioned earlier about meaning, that people are not likely to engage in physical activity if they don't have meaning in their lives. And so that's really, when you look at humanistic counseling, that what that is helping clients find that meaning, find that purpose. The role of the humanistic counselor is to help facilitate growth, looking at those disabling assumptions, beliefs, and attitudes that are getting in the way, that sometimes, no matter where you go, there you are, that you can't get out of your own way. And we see that with our clients. So it's helping them work through that and make more meaningful choices so that we can help them establish that meaning. Certainly a humanistic counselor is going to provide support and encouragement and help them work through sensitive and conflicting feelings. So, and we'll talk just a moment about person-centered as well. But helping clients embrace the opportunity for change. Change is scary. Change can be very scary, especially for our clients who come in. So we want to give them a safe space where they can feel no judgment, no shame, and work through and make those changes. And helping clients become more congruent. A lot of times clients may see themselves in a certain way, like they may see themselves as, oh, I'm stupid. But the rest of their friends and family don't see them as stupid, but they get stuck in that identity of being stupid. So helping them become more congruent with who they are. It's like, okay, maybe I'm not stupid. Maybe I'm really smart in certain areas, but I don't know a whole lot about this area, but kind of getting rid of those, the extremes, and just being more authentic in who they are. So certainly with humanistic counseling, there are threads of client-centered therapy and threads of Adlerian theory as well. So with humanistic theory, I pull in a lot of client-centered therapy as well. So that genuineness, that acceptance, that unconditional positive regard. So, I've done a lot of work with clients who were coming in for evaluations prior to having gastric bypass surgery or weight loss surgeries and things. And one of the things they were required by insurance to come in to have the evaluation, just to say, okay, yes, they've had a psychological evaluation. But the other piece that was concerning to me was the fact that there wasn't follow-up with that. So they could go and have the weight loss surgery or whatever and not get to the underlying issues that were beneath that unless they chose to. They weren't required to by insurance. But that unconditional positive regard reminds me of clients who have come in and they've talked about, maybe they were, seriously overweight. They've talked about the way they've been treated by physicians. Well, if you lose weight, one client said it had a physician, or said it was an orthopedic doc that said, well, if you weren't so fat, your knee wouldn't hurt. And, those kinds of negative messages. So as humanistic counselors, we really want to have that unconditional positive regard and not judge in any form or fashion. And certainly when about with trauma, that a lot of times it's not uncommon for individuals who've experienced sexual abuse to put on weight for as a protective barrier. So we really have to search to understand, and understanding self-concept and its relationship to self-esteem, that how a person sees themselves. If I see myself as stupid, I'm not going to have good self-esteem. So my concept is related to that, and our clients, so we need to be mindful of that. And then self-efficacy, that part of client-centered and humanistic therapy is getting them to come to a place of self-efficacy. So Adlerian theory, like I said, these things are all kind of woven together. We know that behavior is purposeful, and behavior is goal directed. So when you think about that, if let's say you have a client that is super anxious and doesn't leave the house, and doesn't engage in physical activity because they're too stressed, and maybe they're sitting on the couch all day, but that behavior is purposeful. So we want to understand, what is it about my client Susie that makes her want to stay in bed all day? What is it about that? What's the payoff of that for her? Because sometimes there's that payoff, and that it's goal directed. So if we can help them, we talked about making meaningful choices. If we can help them identify what goals they have, that we can maybe help them reach those goals. And I think the other piece, we talked about the social well-being, is that, from Adlerian theory, people are relationship oriented, that we like being connected to other people, and that physical activity can be a way to get clients to connect to other people and develop maybe those missing relationships, that if they've got strained relationships or absent relationships in their lives, that this can be a way to help them become more connected. So we're going to save this last bit of time for questions.
I would like to say something regarding what you said about the doctor might tell the patient their knee hurts because they're too fat. I think that if we weren't so concerned about offending someone because of their weight, it's very unhealthy. And if the doctor could find a way to say, Ms. Jones, I'd like to put you on a diet program to get some of the weight off of your knee. And I believe that we're going to see some success and reduced pain. But it's how they say it, but it needs to be said. I'll give you a personal example. My daughter, who's 33, started dating this guy about 8 years ago, and he just eats crazy, out of control. She started eating like that too. Now she has, I can't think of what it's called, fasciitis.
Plantar fasciitis?
Yes. And some of that is because her foot is bigger. She stands up at her job because she's selling electronics all day. And so her body is not going to operate like it would if she had another job. And she loves what she does. She's a manager. She's pleased with what she's doing. But I tried talking to her about her weight. And what she'll want to talk about is everything that's at the weight. She'll talk about eating clean. Eating clean isn't necessarily going to cause anybody to lose weight. She'll go and buy some inline skates because she wants to skate. And she fell one day. She's always been athletic. She haven't been on the skates again. So sometimes it's to encourage people get back to their habits.
I think that's a good point. And, going back to that unconditional positive regard of it, that if it comes across as judgment, then it makes them feel like I can't do this, like, she fell and then, hasn't been back on skates since, that it's that message. And, I think with physicians and looking at integrative health care, of recognizing that if you have just because you're an orthodox doesn't mean you have to think in terms of a square of a waffle. I'm an orthodox. That's all I do. But if you have someone that comes in that is larger body, that is or overweight and has knee problems, that maybe you, instead of coming across as mean and judgmental, that you think, hey, yes, let's be encouraging, but also figure out what professional might be able to help. Hey, tell me what's going on with you. I know my clients, many of them that have gone and, had weight issues that resulted in other injuries, would break down and cry to their physician about what the injury, how they felt. And the last thing that they need is someone to tell them, yeah, you wouldn't be like this if you weren't so fat. That, it is important that they're getting that encouragement. And one would hope that, physicians would have some training in that area, and perhaps there is even more need for mental health counselors to train physicians and in that area, so that they can be sensitive to those clients' needs, because certainly that's we don't want them to become resistant to physical activity because they believe they can't do it. And thank you for that question, Frida.
I'd rather my doctor tell me the straight truth versus just try to sugarcoat it and make it cute because I'm a female. Tell me the truth.
Right. Yeah. Be honest about it, but be sensitive, I think. Any other questions that anyone has? You can type them in the chat if you don't want to say it out loud. Any thoughts about how you might implement physical activity with your clients? I do a lot of fun stuff with kids too. We have little balls that we catch and things. Families. No thoughts, no questions. It's after lunchtime. Is that or it's approaching lunchtime, maybe?
My name's Mary Ann. Sometimes I ask clients if they've been inactive. I'll say, what did you used to do that you enjoyed? And I even go back to your childhood. I mean, some things you did back then you could still do. So what did you used to enjoy? And to start very simply, but I also encourage people to walk, because I find mentally it's extremely good. And with walking, they can work their way up to walking more quickly if they want to get their heart rate up. They can do it anywhere. If they're traveling, they can take shoes where they can do it anywhere. So I think for a lot of people, it's a very good place to start.
And there's just so many benefits just from walking, and and I've had clients before that have been really, really depressed and can't get out of bed, but it's walking to the mailbox and back was an accomplishment. But it's like, I want you to walk to the mailbox and back, and what was that like for you this week? So I think that's a great point, Mary Ann, is to just find out what have they done in their lives that at any point that was meaningful to them, that they enjoyed.
And I also have done what Corey has suggested. I'll refer people to, like, there's a wonderful place to do yoga here, and they have yoga for all different levels of expertise, and also if you have physical ailments. So, I try to refer people to places where I know they can get what their needs are. So it's not overwhelming and above and beyond where they can get discouraged.
Well, I think that's a great point. And, especially Corey mentioned earlier, clients that have limited resources, but as counselors being aware of what resources exist in your community, because they're in my area, I know there are lots of churches that will have a free, yoga class a week or something like that. So knowing what's out there. So if a client says, oh, I can't, I used to do yoga, but I can't do it anymore because I can't afford it. Or, I used to have a gym membership, but I can't afford it, helping them figure out, knowing the resources that are out there. Let's see, I've got some questions in the chat, I think. Let me go. Okay, this is Danielle. As a certified wellness practitioner, I wholeheartedly agree. Melanie says, how would you approach this with overweight children and their parents? Great, great question. So for me, I have a lot of feeling balls, or I've got question balls, they're little not styrofoam, foamy balls that have little things like, what's your favorite vacation? What's your favorite food? I've got some that are feeling balls, you know, shame, sad, angry, but you toss the ball, and when you catch it, wherever your thumb lands on the ball, you have to answer. So time you felt sad, or different ball is favorite vacation. And so, but I'll do it to music. Sometimes we toss it back and forth. We get, and I'll use it in groups. I use it in families, but I will, do something to get them moving. But with parents, just helping them understand of the importance of physical activity, but something that, let's look at what's something that y'all enjoy doing, or could even do as a family, that maybe we want to ride bikes together, maybe we want to go for a walk together, any of those things. But yeah, I think it's getting, also, I think that, I've got a Thursday presentation on working with families in crisis, but I think that's the other thing, is that children are often the identified client or in the session. So little Johnny's coming to counseling because he's getting in trouble at school and not sitting in his seat, but not knowing that there are other things going on in the family. So that's when I see children that are overweight, I want to find out with the family, what's going, tell me what's going on at home. I remember one child that I was working with, that the mother was a former dancer, and she was in charge of the children's theater, and her daughter was involved in theater. Her mother was so restrictive of what she could eat that the child was hoarding food and became obsessed with food and was overeating. But it was mom's unresolved issues with body image that was spilling over into that. So kind of, I guess I would assess all of that, but figuring out how you can get the family to get the child motivated to engage in some type of physical activity, and not to see it associated with weight. And I think that's the big thing, is that sometimes physical activity is, oh, you've got to get up, you've got to go for a walk. We don't want to eat this junk food and get fat. We got to go for a walk. And then it becomes like, well, I don't want to walk. That's not, it loses its intrinsic reward. Did that answer your question, Melanie? Is that helpful? Okay. And Paris, hi Paris. Yes, increased oxygen to the brain and increased blood flow, decrease the progression of negative health outcomes. Absolutely. And Karina said, great presentation. I thought of a recent client I worked with that was experiencing depression and anxiety and had a history of trauma. We did a self-assessment to look at their overall wellness. The client recognized lack of physical activity they incorporated into their daily routine and reported a relief of symptoms. Great info to have. Great. And, I think that's important, is that the client came up with it, not that you told the client what to do. And that the client knows more about themselves than we do, and giving them that option, or that giving them the ability to make those decisions and choices, like we said. Paris said, thank you so much for sharing. So, okay, well, I know we're getting down to the end of time. In the chat, I think Alita gave some information about continuing education. If you, for those of you who need that there's a form that you have to fill out. And I just want to thank you all for coming and spending your afternoon with us. Corey, thank you for sharing your wealth of information, and I hope you all have a wonderful day.
Thank you.
Thank you.